So you began your collegiate career as a Bachelor of Arts in Biology student at the Huntington College.
Yeah,
Tell us about that thought process.
I loved biology since at least high school. Now it was way before that. I always loved animals and weather and the environment, going out and viewing wildlife and all these things. And I absolutely decimated my biology courses in high school. It's just very clear this is a natural fit for me. So I knew I wanted to go into biology in undergrad. I loved it. And I definitely considered for a while making that my focus in grad school. There was something that kind of hit me like, I'm going to focus on the social sciences instead. And I just kind of, I guess I have to trust that instinct because there are many days I'm like, man, I'd really love to have a PhD in botany or something like that. But I'm using what I have. I like to think I'm using it for good. But you know, what I've learned in biology is very informative. A lot of theories that we have in epidemiology and sociology come from ecology, right? We developed a lot of those models from ecological frameworks. And I think Darwin's theory of evolution is one of the most important, impactful theories of all scientific theories. Up there with thermodynamics and cell law and things like that. And I think that one of the most important books that I've ever read personally is Edward O. Wilson's Consilience, and it talks about how all knowledge is a spectrum. And I've been talking so far about zooming out with public health beyond the level of the individual, but I think that we should also zoom in, right? There's a growing emphasis, a growing recognition of cellular medicine, and even beyond that, quantum medicine. And I'm excited to see those things. So to me, biology kind of grounds me in realizing that as much as I have the expertise in zooming out, we also have these other perspectives. I do think that there is this continuum of knowledge that exists from genetics all the way up to epidemiology, and we haven't filled in all those gaps. But I'm very confident that they're there, and it gives me some of the natural sciences as well, because I went all social sciences after that.
And while you were an undergrad, you also had experiences as a youth minister assistant at First United Methodist Church, Summer Stafford Youth Works, and director of youth ministry. Tell us about those maybe key responsibilities or why you decided to take on these roles.
Well, I mentioned a bit ago that I'm currently pursuing a Master of Divinity, and then you just mentioned those jobs that I had while I was in college, and one might conclude that I have a certain religious identity, and I think one could reasonably conclude that most of my reason for pursuing a seminary degree now is personal interest, even as my own ideologies have shifted over the years. I have no desire to do ministry at all. I was raised in a very progressive, moderately progressive denomination, the Cooperative Baptist. And I went to a Methodist school, and those were just really important experiences for me. And I'm glad that I had them. I can say that I've done that. I don't care to be a professional minister now. It's just, we go through a lot of phases, right? I've been a professor of college students, and I had some students every semester, they wanted to do something different. I was that person too. So I get it. I also think that one of the things that I love about having a broad background is that I think it allows me to relate to a wider array of people, right? And while it is true that me going to seminary is a personal thing for me, it's professionally, as a gerontologist, most people die in older age. And so there's that crossover with focusing on end of life issues. And that's where spiritual questions come up. I basically just want to be able to have a conversation with people that's emotionally mature, intellectually mature. And if they're a religious person, then maybe I'll have enough tools in my tool belt to be able to relate to them, right? And so I can draw from those experiences that I had in college. I can draw from what I'm learning now in seminary, and that's just kind of one of my goals. I want to be able to relate to a wide array of people. Hopefully that makes sense.
Yeah, absolutely makes sense, and I'm glad. I guess it got you to maybe reflect on that part of your journey and that evolution of whatever your beliefs are.
I-
Were
I'm
they
on I'm on a lot of podcasts, and no one's ever asked me about that aspect of my work. So thanks for doing that.
Yeah, yeah, my pleasure. And it's interesting. Me and my brother just went and saw. I don't know if you've seen it, Heretic. It's a movie that's out in cinema now. I feel like you might appreciate the kind of context of that movie and like
I'll keep that
just
in mind.
yeah, just like questioning maybe those religions and belief systems. So maybe you could watch it and let me know what you think.
All right, sounds good.
Awesome. So were there any undergrad takeaways that you had coming out with your bachelor's in biology?
There's a whole lot of pressure these days
Mm.
for people, for undergrads to think that they're what they choose as a major matters, and it can if you want to go into med school, then you have to take so many science classes, but that doesn't determine what major you need to do. If you want to go into nursing, you got to take certain classes. But even now, they have these fast track masters of nursing programs, master of social work programs, and whatnot, where you can major in anything. I would just encourage people to realize that their interests are going to change. And even if you have multiple interests, but you choose one major, you're not abandoning these other interests. And I think the other thing, if you feel pressured for, is having a really, really good GPA. I'm not saying that it's not important, but listen, I had below a 3.5. I was on academic probation for one semester because I got terrible grades, and I now have 2 masters and a PhD. Like, listen, it's gonna be okay. It's going to be okay. Um, and also just take whatever experiences come your way. I also traveled around the world, and that kind of started when I was in high school, and then really ramped up when I was in college. Um, and when you have an opportunity, even if you think it's outside what you expect your professional interest to be, go take it. Go take that adventure. Go do it. And I don't regret any of the interesting or adventurous things that I've done, any of the countries, any of the travels that I've done. Some of them are really expensive and put me in debt, but I don't regret any of them because they're experiences.
I feel that. I feel that. Just don't go too deep in depth for those kind of experiences. But yeah, we only have one life to live, and there is so much value in traveling and doing these things that bring us joy and filling our cups. So I appreciate you sharing that as well.
Yeah.
So maybe walk us through the process of you graduating, maybe working, and then shift because you said that you were in this bachelor's in this biology perspective. I wanted this biology work, and then you kind of shifted more to a more macro meta social sciences perspective when you decided to pursue a master's of social work. So walk us through more of that change and okay, I want to do this instead of that.
Well, first of all, in undergrad, I was all macrobiology. I took ecology, animal
Hmm.
behavior, field botany, field zoology. I loved the macrobiological courses. So even from an early time, I recognized that I liked the larger lens there. I knew coming out of it that I wanted to do either 2 masters or something very, very interdisciplinary. At that point, it was really clear that that was the case. Um, and my dad had a social work degree, and so there was that. And social work is one of those fields. Public health is another one where you can they have a lot of dual degree or combined degree programs. Social work and law, public health and theology, social work and business, public health and medicine. Like there's so many combinations. I'm like, okay, social work is clearly one of the ones I'm going to do. It makes a lot of sense. I'm used to my father had that degree, and then I was in Uganda. I had this moment. We first I was on a team of it was a service learning trip. 13 of us college students, and we went to several countries, but we went to Ethiopia and Uganda back to back, and we visited clinics. We visited really rural areas, and we saw some of the poorest places in the world and some really awesome projects going on. And I'm like, this is public health, and this is what I want to do. And so that's when public health hit me. And so there are a lot of programs that offer social work, public health dual degrees, and I applied to a few of them, and I went to one of them. And that's kind of how that came to be.
That's awesome, and I think like just going back to what you're kind of saying is like putting yourself out there and getting those experiences kind of help to shape what that next step might be for you.